Hi everyone and welcome back to a warrior's journey. So let's proceed where I stopped last time. So I was told that I have severe hydrocephalus or severe accumulation of fluids in my brain and that we need to perform an emergency surgery to install an EVD or external ventricular drain to release the pressure and the extra fluids from my brain. These fluids are called cerebrospinal fluids. What actually happened is that I had a hemorrhagic stroke on the 17th, and the blood clogged the channels that dispose the cerebrospinal fluid that is produced in the brain. And in those 2 days before I got the CT scan, the fluid was accumulating in my brain ventricles. Now, as I said, it's called cerebrospinal fluid, and it's produced in the brain and usually cushions the brain and the spinal cord, and it protects them from impacts or anything, and also gives some nutrients and takes some waste from the brain and the spinal cord. So anyway, I was told that we need to perform an emergency surgery, and I've accepted that reality. And then I was transferred to the intermediate care unit for maybe 30 minutes until they prepared everything for the surgery. And I was then taken to the operating theater. I honestly feel like I was not conscious enough to understand what was happening. But anyway, we did the surgery and they drilled my skull from here and they installed a tube or EVD external ventricular drain, and they drained the fluids and the blood from my brain, and when I woke up from that surgery, I think I was the most alive in my whole life. I was pain free for the first time maybe in a month or so, and I was extremely happy considering that I just had a brain surgery. It wasn't easy, but I was extremely happy with it because you cannot imagine how relieved I was because I was not having any pain, or and the whooshing sound that was very severe in my ear wasn't there. Maybe it was anesthesia, I don't know, but I was extremely happy and feeling alive on that day. So after we did that surgery, as I said, I was feeling so much alive. And after that, they started the procedure for understanding why I had hemorrhage in my brain. So I was sent for an MRI, and they made an initial diagnosis that I have an arteriovenous malformation in my brain. And to confirm that diagnosis, I was sent for an angiogram on the 23rd of August, I think. 23rd, yes. So I was sent for the angiogram, and they did the angiogram, and the diagnosis was quite clear that I have a brain AVM or a cerebral arteriovenous malformation in the pineal area, in the brainstem and basal ganglia area in my brain. It's a very delicate and very difficult spot in the brain, and it was a big AVM, and there was no chance in doing a surgery to resect or to remove the AVM. And I received a report from the physician who was in charge of my case, and it was the most shocking thing that happened to me until that day. Basically, the report said that the patient has a huge arteriovenous malformation in the pineal area in his brain, and it's not operable, and the only solution is to do radiation therapy just to reduce the risk of bleeding. But when I read that report, I just felt that I was a hopeless case, and it brought me into tears, and it honestly broke my heart for a few minutes until I was able to absorb that shock. I was able to absorb everything until that moment, but reading that report and feeling helpless and feeling that I was a hopeless case, it was pretty hard on me. But anyway, I absorbed it eventually, and the report also said that in regards to the hydrocephalus that I have, the solution was to implant a VP shunt. It's a drainage tube going from your brain to your abdominal cavity. It's called the VP shunt. And that's what we did. I had a surgery on the 25th of August 2015 to implant the VP shunt. And as I said, the whole time being in the hospital, I was feeling pretty well, because after that amount of pain you have been through, it's uh, it's quite relieving to be pain free. And also, I had so many people around me. I think my hospital room was the most populated room in the history of the hospital, because I had so many visitors and so many friends coming in. And I remember when they used to drain the brain fluids or the cerebral spinal fluid manually, my friend came to me and said we should take these fluids and give them to some stupid friends of ours, just to make them a bit more intelligent, because you are so intelligent. And it was funny as hell, and we laughed a lot about it. So they were good times, and given that I was in a hospital and I was in the intermediate care unit. But these were relatively good times, because I was happy, I was pain free, and I was able to react and move. Before the surgery, I could not move my neck, and after that, I was able to move my neck freely. So it meant so much, and I was pretty happy with that. Only that the that day when I read the report that I was a hopeless case, I was pretty devastated. But other than that, it was pretty good. And the doctor who diagnosed me told me that when he saw the CT scan, the image that he did for me, he couldn't believe that I was still conscious, or I was able to speak or react with him, because the hydrocephalus was pretty severe. So I suppose I was pretty blessed, and I thank God every day for that. So I spent about 2 weeks total in the hospital, and after that I was released from the hospital. I was in a good shape, relatively. I was able to walk because they taught me how to walk again. I couldn't walk at the beginning, but I did not have any problems. So I picked up walking very quickly. In a week time or so, I was able to walk. I had a little bit of weakness in my left leg, but it wasn't severe, and I was able to function normally. So I was released from the hospital, and I was very happy with it, and I was on my feet, and everything was almost back to normal. I had some pain where the shunt was implanted, and where they opened my belly, but that's fine. And other than that, there was nothing wrong. And if you looked at me, I was looking pretty well, but I lost so much weight. I was maybe 45, 47 kilograms. That's less than 100 pounds. So I lost a lot of weight in the hospital. That's because I don't really like hospitals food, and usually do not eat. So that's because of losing so much weight. I wasn't very heavy anyway. I was maybe 53, 54 kilograms. I only lost around 8 to 10 kilograms, so it's not much. But anyway, I was released, and I was happy. And a few days later, my father took my reports and everything, and my images, and my angiograms he did, and he went to the radiation treatment center. There is only one center here in Jordan, and it's the only center in the country, and it's the only center in the Middle East. So my dad went there and he took my reports and everything, and they told him, yes, bring him, and we will do the operation and we will give him the radiation treatment, and hopefully everything will be okay. And on the 25th of October, as I remember, we went. I was fully recovered at that time, so we went to the radiation treatment center, and I had the stereotactic radiosurgery or gamma knife. At the first, they get you in, they admit you, and then they screw the head frame on your head. It's four screws that are screwed into your skull just to fix the head frame on your head. And after that, they send you for an MRI, and after that, they send you for an angiogram. They did not have the ability to do the angiogram in that center, so they sent me to another hospital in the ambulance, to the angiogram, and brought me back to the radiation center, which was a bit of a pain, and it was exhausting to be transferred from place to place, especially with that head frame on your head and not being able to move freely. But anyways, I was taken to another hospital for the angiogram, which we did, and they brought me back to the radiation treatment center, and they started planning the radiation therapy or the session. And after maybe a couple of hours, I was taken into the treatment room, and it's similar to the MRI machine. You are laid down on a bed, and they roll you inside a machine, and you receive the radiation treatment, and it's painless. I took the radiation treatment. I think it was 83 minutes of radiation with your head screwed not only to the frame, also to the bed that you're sitting or lying on, and not being able to move your head for 83 minutes. It wasn't very nice, to be honest. But they give us a report explaining everything that they did, and the report said that the chance of obliterating the AVM was 90 to 95%. And it contradicts with what the original physician said, that radiation treatment was recommended only to reduce the risk of bleeding, and this report said that the chance of obliterating was 90 to 95%, which of course wasn't right, and it's something that I learned afterwards. So we did the radiation treatment, and we went back home, and the second day I was completely functional. I had some patches where the screws were, but I was able to remove them the second day, and I was pretty well. I had no issues at all. So I think I will stop here for this episode, but before I stop, I want to say a few things. The first thing is that at that point in time, I don't think I had the sufficient understanding or comprehension of what was going on, because I did not read or learn anything about my illness, and I was doing everything as instructed. So I was told to do surgery, and I did, which is something I'm glad I did. And I was instructed to do radiotherapy or radiation therapy, which and I did, which is something I'm not very happy with, and we will get to that at some point in the story. But anyway, after the radiation therapy, I think I was sober enough, and I was in a good state of mind to start reading and learning about my illness. And I started reading and learning about brain AVMs and AVMs in general, and the treatment options and everything. And I did so much reading to an extent that even my physicians were very happy with the knowledge I acquired. And from that point in time until this day, I've been calling all the shots regarding to my illness and my treatment. The second thing is that an arteriovenous malformation is a rare disorder. It is usually, in most cases, a congenital disorder that people are born with, but in very rare cases, it can develop during your life if you have some genetic problems like something called HHT. It causes AVMs to develop during life, but it's usually a congenital disorder and it's rare. We're speaking about 18 for every 100,000 people, or for brain AVMs, I think it's 3 for every 100,000 people. So it's pretty rare when you're speaking of brain AVMs. And brain AVMs are not always treatable. In many cases, they are treatable, but in some cases, they are not. So sometimes the only option for an AVM is management, and the other options are either surgery, radiation therapy, or embolization, which is a catheterization procedure where they inject a glue-like material in your arteries and veins to close them. And an arteriovenous malformation, just let me explain a little bit what is an arteriovenous malformation. So there are three kinds of blood vessels in your body. It's arteries, veins, and capillaries. And capillaries are very fine blood vessels. And the connection between arteries and veins is usually done through capillaries. But in arteriovenous malformations, there is a direct shunting between arteries, which are high pressure blood vessels, and veins that are low pressure blood vessels. They are directly shunted, which is a wrong setting of blood vessels. It's usually arteries, capillaries, and veins, then veins. But in arteriovenous malformation, they bypass the capillary bed, and the veins and arteries either are directly connected, which forms a weak spot, and it's susceptible to bleeding. So that's basically what an arteriovenous malformation is. And I think these are the things that I wanted to say, and I will hopefully continue the story next time. See you next time. Bye.